Channel 3 is your vaccine authority, and we've been getting so many questions about the vaccine lately. Each and every day, we are doing our best to try and get you some answers. And joining us this Tuesday afternoon is Dr. David Hill, the director of the Global Public Health Program at Quinnipiac University School of Medicine. Dr. Hill, thank you very much for joining us today. We appreciate it.
Thank you. Delighted to be with you.
Well, we've got a question right up from John from Waterbury, who is asking this afternoon here, what is the longest you can wait between your first dose and your second dose of the vaccine? Obviously, we have two different doses, the Pfizer and the Moderna, that require you to wait.
Right. So just start out with the Johnson & Johnson. It's just a single dose, so there's no difference. You don't need to wait for a second dose because there isn't one. It's best to complete the series with the same vaccine and to try and stay as close as possible to the 3 weeks for the Pfizer and the 4 weeks for the Moderna. In England, they are extending the second dose for the vaccine out to 12 weeks, and it looks like that's still immunogenic. So the message here is try and stay within the 3 or 4 weeks, depending on the vaccine you got. But if something comes up and you're delayed a week or 2 or 3, it is absolutely fine.
Okay, that's some good news there. Now, Tricia wrote in, she wants to know, the CDC says the seasonal flu vaccination may reduce the severity of flu illness in people who get vaccinated. If one is vaccinated with either the Pfizer, Moderna, or Johnson & Johnson COVID vaccines, will the severity of the symptoms of COVID-19 be diminished if you contract COVID-19? I hope you followed that because I'm not sure what she's asking here.
Yes. So if you get a vaccine but still get COVID despite having the vaccine, will your symptoms be less? And the answer is yes. For instance, the Johnson & Johnson vaccine is less effective at getting infected, but it is very effective against severe disease or hospitalization or death. So getting the vaccine, these have high efficacy to prevent infection in the first place. And if you do get COVID, yes, your symptoms will be less.
Okay. Our last question this afternoon, does the type of reaction you have to the vaccine have any correlation to how weak or strong your immune system is?
So the answer to that is really no. For all comers, the vaccine efficacy, protective efficacy for Pfizer and Moderna was 95%, and that's in people who had a severe reaction and people who had a very mild or no reaction. So if the vaccine is in your arm, you can be well assured that you're going to be protected.
Before I let you go, Doctor, we obviously heard today about the first UK variant death here in Connecticut. How do you feel about where we're heading right now?
Well, we've got a good convergence of having now 3 vaccines. We've got almost 25% of our population in Connecticut has had a single dose, and around 10% have had 2 doses. So I think if we can stay ahead of this with the vaccination, and if individuals of Connecticut can continue to wear their masks and practice physical distancing, we'll be okay.
Okay, Dr. David Hill from Quinnipiac University. Thank you very much for joining us this afternoon. We appreciate it. A beautiful day. I know it's an image behind you there, but it's a beautiful day on campus we can see.
Absolutely. Thank you very much.